Let's talk about reducing healthcare disparity. That is the goal among communities of color, and it's a priority among our local health centers as a whole. But solving the problem is not an easy task because it involves far more than just healthcare. Senior health correspondent Monica Robbins explains there's a research project trying to get to the root of the problem by giving people the tools to empower themselves.
Fonda McClain is a certified community health worker. For the last 6 months, she's been out in the community, visiting neighborhoods of the Cuyahoga Metropolitan Housing Authority. She sees health care gaps firsthand.
Food insecurities, not having enough food sources in different areas, not having pharmacies in different areas, not addressing mental health.
Those disparities often lead to poor health choices and eventually disease.
Cardiovascular disease is one of the most common reasons why people die because of heart attack and stroke. And that happens to be a very common cause of mortality in urban African Americans.
That's why the National Institutes of Health funded a program in Cleveland and Detroit to see if grassroots efforts can make a difference. It's called Addressing Cardiometabolic Health Inequities by Early Prevention in the Great Lakes Region, otherwise known as Achieve GreatER.
What we want to be able to show is that the community health worker model is actually a model that's worth investing in.
Fonda is on the front lines of saving lives. Nadine Head was one of the first. Like many, Nadine has a myriad of health issues, including obesity, diabetes, and hypertension. Just walking made her winded. But when Fonda strolled in, she gave Nadine the tools and education she needed.
I started eating vegetables, and I stopped eating hot dogs and cold cuts.
Fonda gave Nadine technology like a Fit Watch, a smart scale, and blood pressure cuff. Daily check-ins are monitored by a healthcare provider. Once Nadine understood how it all worked, it motivated her to make a difference. She also started exercising, slowly at first, but now walking is a breeze. In 6 months, she watched 50 pounds melt away, a huge impact on her diabetes and lung issues.
I can actually come off my medicine now. I can breathe. It don't feel like someone sitting on my chest anymore.
Having someone she can relate to helped Nadine start to trust healthcare again. The hope is she'll inspire her neighbors to do the same.
Their support staff is their conscience. We address those things to add better quality of health to close that gap for them.
Achieve GreatER will pay for community health workers, nurses, and care coordinators to work with CMHA and provide health services, including free risk factor screenings. A nurse dietitian pharmacist will also join the research, and Better Health Partnerships, a Cleveland-based nonprofit, will partner with UH to help offer community health worker model of care to provide sustainability for this effort beyond the grant funding period of 5 years, Christy.
50 pounds. That's remarkable. Good for her. All right, Monica, thank you so much.
Sure.